Welcome to the bold analysis. Today, I am a bit disappointed because we keep on saying that we cannot run a state through sheer propaganda. Whatever is happening in this country, whatever is happening in darkness, is coming out clearly in broad daylight. Last week on Wednesday, the Deputy President of Republic of Kenya, Abraham Kithure Kindiki, had an impromptu visit in Kenyatta National Hospital. And we saw videos of Kindiki in that facility, walking around, mingling with patients, and visiting different departments, different wards, so that he could actually see how things are running in that national hospital. Ladies and gentlemen, the visit by Kithure Kindiki was actually touted as a working tour in the facility so that he could come out and tell the country how SHA is working. And you could see Kindiki with the current Cabinet Secretary for Health, Baraza, carrying even children and mingling and saying the way things are working. From Kithure Kindiki's appearance, the way patients were actually, the way he was mingling with the patients, after coming out even to make the press briefing, you would actually believe that SHA is honestly working. Now, I want to show you a video of an incident that happened today. And this should be a warning shot. And this is really exposing what exactly is happening in government.
Others came from Kibwezi, others have come from Mombasa. SHA is not working and they are not approving. From Wednesday last week, the systems are down. Please stop, madam.
Hi, my name is Diana. I had CS done 2 weeks ago. And then there are some complications. We have to join Kenyatta again. Nothing is going to happen unless SHA approve. Hawatakupatia usaidizi wowote, you would get treated. Sasa nimetembea all the way from Kenyatta tukaenda mpaka pale SHA house. Fika SHA house tumeingia ofisi gani, go this, the system ziko chini. System ziko chini aje? Pesa inaingia, ukilipa SHA, you told lipa 6 months upfront. Ukilipa SHA inaingia, pesa inaingia, hiyo haihang. Lakini matibabu hatupati Kenyatta. Sababu ya nini? SHA haifanyi, sijui OTP haijatumwa, sijui nini. Over there we had many people working. Hapo Kenyatta wako nje hawasaidiki. Sababu ya nini? Hawezi saidika unless SHA ikuwe approved. Seriously, whoever is in charge, SHA thing, si utusaidie. We are going through a lot. Huyo mbaba mtoto wake alimeza coin, hajashughulikiwa kwa pale Kenyatta. Akikufa sababu ya hiyo SHA.
Na mtoto hajakula kutoka jana.
It is not fair actually.
And there are patients waiting there outside the gate. Wameshinda wakinipigia simu. We've worked in the offices of NHIF. We've gone to all those floors. I've even gone to the ICT department. I've gone to the pre-authorization. They are not able to give us any access. They are not able to get into the portal.
Mnazungushwa, ukienda kwa hiyo ofisi go there because they know very well utasaidika at the end of the day. Unaenda huku unachukua enda huku mwingine. Ukienda huku tunaambiwa tutafute yes who. Haino yes nani ule? Kemani ama ndio nani? Tunazungushwa tu, can we just get answers surely? Tunaumia. You think coming here tunaumwa, you have to get the courage ufike mpaka hapa.
And you can imagine she has a baby. She was done a CS section. She's supposed to go for review for operation. She cannot do that because of a SHA. Something called SHA. She's carrying the baby everywhere she's moving. She has been there for 3 days. And nothing is being approved. Now you can imagine I've decided to come and help her. And also me myself, I'm sick. We also have other patients. There are people who could not walk. We have walked all the way from Kenyatta Hospital. Miguu mpaka huku. Na tumeteremka huko in hiyo NHIF building. Nothing was done. We were not helped. So when we come here, we are coming here as Kenyans and we are asking for whoever is approving or whatever is happening. Can you talk the truth?
Kithure Kindiki, 7 days after he visited Kenyatta National Hospital, today, patients walked out of the hospital beds and they went to NHIF building demanding that SHA approvals be done. Because apparently, according to those patients, since last week, SHA has not been working. This is the rage. It is very shameful for the country. It's a big embarrassment that patients have to walk all the way to leave their hospital beds and go to NHIF so that they can protest about SHA. Women carrying their children, patients going there. I'm saying this is a message for Abraham Kithure Kindiki and Ruto administration. Let me tell you, can you listen to the speech that, can you listen to this video? I wanted to watch this video because when Kithure Kindiki was there, they even paraded, the hospital management even paraded some few patients there to give testimonies on how SHA has helped them.
Convincing people to transplant. Because you tell them, okay, dialysis is reimbursed by NHIF. NHIF will work with you until the surgery, but then after the surgery, you're on your own. The post-transplant medication is on you. And you know the consequences of not taking anti-rejection medication is graft failure, and you go back to dialysis. So people are saying, what's the point? I can't afford the treatment. But right now, SHA has now expanded the cover to include post-transplant care. And it's important, I think, for Kenyans to hear from their own so that it can be believable.
My name is Dan Kapucho. I'm a beneficiary of SHA, which is Dan Kapucho. I'm a beneficiary of SHA here in KNH. As the doctor has said, before, after transplant, we used to be on our own. We cater for our medication, which is a bit costly. But when SHA came through, it has really helped us. The cost of medication was coming to around 30 to 40,000. But SHA per month. Sorry, yeah. But when SHA came through, now it has cut the cost half, which is a benefit to us. At least that amount can help me to do something else. Yes. Actually today I was coming for some more medications for this month, which I'm just waiting for approval, and then I go and get the medication.
My name is Mercy Kamau, a post-kidney transplant 2 months ago in November here in Kenyatta. Mimi niko tu na furaha sana because of SHA, because I could not afford the whole surgery cost and the post-treatment, but SHA paid for me and my donor about 1 million shillings. Yes.
So you were the
my donor, yes. I didn't pay anything.
When was that?
In November. Yes.
Had helped them. And the government rank and file tagged along Kithure Kindiki to try to show the country that SHA is working. In real sense, you cannot run the country by propaganda. And let me tell you something. If you've ever gone to Kenyatta, I have gone to Kenyatta 3 times. One, I interacted with the hospital facility when we were helping Sarah, the very first person that we helped under our charity program. And I also went there when my sister got involved in an accident. The third time I was in Kenyatta is when last year in October when we were discharging baby Becky, for those of you who remember. Now let me tell you, you cannot be allowed to leave the premises out, to step out of the premises with balances. The decision, the move by the patients to be allowed to go and protest in NHIF buildings about SHA is a very clear message that Kenyatta Hospital allowed it, gave them the permission, and knew what exactly the patients were going to do. In their numbers, they staged a protest in front of, at the gate, the NHIF building, the very day that the CS, Nancy, I can't remember the first name, Baraza, was supposed to give a press briefing about the universal health coverage. So I want to tell you this. For the patients to be allowed, the coincidence of patients being allowed to leave the hospital at a time a CS is supposed to give a press briefing, that coincidence can only tell you that all that was choreographed and it was organized by the hospital management. The hospital knew that at this specific time, Baraza is going to make a press briefing because the CS was supposed to make a press briefing in the NHIF building and speaking about the state of SHA. So it was not a coincidence. And the mere fact, and there is a message, if the hospital facility allowed patients to go and stage a protest rage at the SHA offices the day and the time a minister was there, that is a message that even the hospital facility is getting frustrated by the SHA system. Or they got overwhelmed by the pressure from the patients. And I think we have to be intentional about this. The SHA is a matter of life and death for patients. Kindiki made a speech, and Kindiki confirmed to the country, confidence to the country, that SHA is working. Today, our mothers, our siblings, and our fathers are leaving the hospital bed in stretchers so that they can go and at least beg for the system to work. The 3-minute video, the 2-minute video should be circulated. And I think the president should look at it and know it is not just fine, it is not just cool to go and spend time on top of the car while back in the office the system is not working. It is not. It is not. The second question is this. Is it deliberate? What is this coincidence that for 7 days that system is not working? Remember, that system is supposed to do approvals. It is supposed to approve the claims so that when the claims are approved, payment is done. Now, it could be a strategic delay tactic to crash the system so that the claims are not done because the payment may not be made at this time. Is it a sign of cash crunch? Is the government broke? Is the government broke? Patients interrupted the interview session, the press briefing by Waziri Baraza. But I also know that Waziri Baraza recently was in the news for a fallout with the PS Kimutai about some appointments that were made. So the infighting between the PS and the CS are in public. This sheer show of working, the failure of SHA, can also be well stage managed to make sure that Waziri, that CS, is pushed out. These things are possible. But I don't want to get into this. I don't want to get into that angle. I want to confine myself to a very serious question. The government is showing confidence that the system is working. But the patients are saying that system is not working. Even as we talk, there's been a problem of fuel. The cards, when they go, when some government vehicles are grounded because of fuel. I think they were supposed to make payments in December. They made the last payment in December. So there have been a problem. People have been moving from one department to the other asking for fuel, which is an issue. There seems to be a big problem because even NHIF, I saw this statement when students were demanding that let help disburse the money. Ladies and gentlemen, this is what is happening. And I think much as we want to make political statements and run confidently telling people that SHA is working, we cannot run this by propaganda. And this is what I would want to tell the people that are managing this transition. The success of SHA, success evaluation of SHA is not based on how many people have registered. I've been seeing government spending money going to counties. 2 days ago, I think Moses Kura was in Mombasa doing some marketing, creating some awareness on SHA so that people register. And back in Nairobi, there are those who are running statistics, some figures that SHA is a success because 15 million people have registered. What is 15 million out of a population of around 60 million? I think we are almost 70. So the government should stop that petty narrative of SHA is working because 15 million people have registered so far. I think it is even 11. Surely, the evaluation on success of SHA is not based on how many people have registered. And again, I want to appreciate the fact that on chronic illness, it is supposed to bring a good intervention. They've been saying that SHA have better benefits, improved benefits compared to NHIF. But those low-hanging fruits in SHA are only attractive if they can be paid. But you cannot have low-hanging fruits in paper, in press briefing, on top of car. You can explain. But the patient there is what matters. Yesterday, I listened to Kagwe. Kagwe said, the focus in agriculture docket, I'm just using that example to draw a point, kindly, I'm not deviating. The focus in agriculture docket is to ensure the farmer has the money. The focus in the health docket is to ensure that every patient that walks to a hospital can be treated seamlessly without hurdles. That should be the focus in the agriculture ministry, in the health ministry. But with this, then SHA is a big flop. Number two, the money that was from NHIF to SHA, where was it taken? Because, let's look at it. SHA, the government was supposed to pump in money for the basic health care and the chronic illness. Now, we did a transition within a day from NHIF to SHA. But even to the last month of that transition, Kenyans were still paying NHIF. Why is it that that transition happened, even if there have been a problem of system? But why is it that inaleta shida sana while pesa ilikuwa kwa NHIF zenye zimepelekwa SHA? Of course, SHA is a new registration. But I think even when transition happened, did we play around with the money that was at NHIF? Because it can't be that all along now we've become broke. We cannot meet that obligation. Something is simply not adding up. Number three, the financial hurdles could also be attributed to low registration. And that low registration is only about communication. People don't understand. Someone already have NHIF is wondering what is the difference. People don't understand. And lastly, I feel the 104 billion ICT infrastructure, it should be abandoned. If it is hanging for 7 days. Remember, the one that we're using in NHIF was only 700 million to upgrade. So we abandoned one that was only to be upgraded at 700 million, and now adopted a new one that is to be made at 104 billion. Then for the whole 7 days, if that hanging is not stage managed, we need to do something. And there is a problem with the system. Last week on Saturday, I was going to Kenyatta. There was a long queue in Nairobi National Park because the e-citizens had collapsed. So people who wanted to access the park could not. So there is a big system. Even, I think recently there was, now university's fees is now paid through e-citizen. I think that was Maseno, who were paying for one of our students that we normally sponsor here. I think most of you know her, Marvel. So when we were paying fee for Marvel, the whole thing collapsed. The system collapsed. And it had to be delayed simply because of that e-citizen. There is a problem. And we tend to be two things involved. The delay is stage managed, or government doesn't have money, so it's causing the delay so that payments or claims are not made. But whatever has happened today is a big embarrassment to the state. We must be intentional. We cannot run the country by propaganda. Thank you.